My name is Eric Kolb. I'm a bioengineer and co-founder of ELIDA, again presenting on our patient-applied surface electrodes for treating stress incontinence. So as we know, the prevalence of incontinence is very high, up to 1 in 3 women, and electrical stimulation has been widely used by physiotherapists to treat incontinence with known benefits. However, therapies using vaginally inserted devices are often suffer from low adoption rates due to hesitance of women to use these invasive products. So we considered, is there a better solution for this patient population? We looked back at the literature and realized that over the past 4 decades, there have been a number of researchers who investigated use of surface electrodes for treating incontinence with very positive results as recently as in the 2010s. Additionally, advances in new materials, including hydrogels that can be applied over hair, as well as conductive inks that conduct electrical currents, and miniaturized electronics really provide some interesting opportunities for developing new products. The prototype that we developed is an electrode. It's very thin, applied to the patient's perineal tissue, and then the user can apply their underwear and outer garments over this and receive treatment through a small stimulator that can be worn at the belt. The photograph on the right depicts the prototype unit that was tested in this study, sized against a U.S. quarter, so it's a very small device. In the study, we looked at 8 subjects who used the device in an acute treatment. Each of them was evaluated with multiple waveforms and self-reported both the comfort at the skin electrode interface as well as perceived muscle contractions. We also had active monitoring of electrical outputs that are all very helpful for electrical engineering purposes, and made observational human factors assessments to assess whether the instructions for use and the operation of the device was suitable for the home use environment. Several of the waveforms that we evaluated are depicted here in the slide. All provided stimulation frequencies of approximately 50 hertz. The topmost image there shows a traditional intravaginal or waveform used with an intravaginal probe, which in our application realized fairly minimal skin or muscle contraction or skin sensation. When we moved to waveforms that were more common in musculoskeletal EMS devices like a burst mode alternating current, sometimes called a Russian waveform, realized a stronger muscle contraction, but also some stimulation at the skin interface. The waveform that ultimately was preferred by this patient population is a modulated signal at 2,000 hertz that was both comfortable and realized a comfortable contraction of the muscles. So all patients realized this, were able to apply the device with minimal instruction from us, the investigators that is. They reported a comfortable tightening of the pelvic floor muscles and often described it in terms of a lifting sensation or that being similar to Kegel exercises. We measured the impedance through this tissue between 500 and 1,000 ohms, which is consistent with other application sites of muscle stimulation. Interestingly, even though this is a fairly small sampling of patients, we didn't see any obvious correlation to body mass index or age or incontinence symptoms. And collectively, these observations all support the opportunity for using this type of device in a home use application. Our next steps are really to finish some ongoing clinical studies we have in the U.S. That look at the efficacy of this product through 6 weeks of active treatment, also approval through the FDA and CE marks, and we anticipate commercial availability into 2018. I want to give thanks to the National Science Foundation in the U.S., which is our primary sponsor for this research, as well as Connecticut Innovations. Thank you.
Thank you very much.
Beth Shelley, physical therapist in the U.S. I see the BMI that you have reported, and I certainly have patients that are above that. I'm wondering if you have any thoughts about the depth, because certainly we know if you're closer to the nerve, you'll activate more completely.
Absolutely correct. We took BMIs up to a level of perhaps obesity, but not morbidly obese patients. And in the U.S. and elsewhere, there's certainly a high population of folks that exceed our BMI index. Yes, that's something we're going to have to research further to get a conclusive determination, and whether that means we need to increase the output capacity of the device possibly for that patient population, or manipulate the location of the electrodes, all things for further research.
So they can increase the intensity themselves?
They adjust it to a level that achieves a comfortable contraction. In this device, it's up to 35 milliamps of RMS current.
Right. And do you're not having them shave?
We did not have them shave, correct.
Did you notice any difference when you had some with more hair versus less?
I wasn't necessarily privy to the amount of hair they had. Most of them claimed they had not recently shaved. And so beyond that, I can't really comment.
It's probably something you want to include in your research.
Fair enough.
Just because clinically we would need that. And I know that you and I talked in the exhibit hall that you really need to test that they actually are squeezing. Just a person's report that they're squeezing is not sufficient. So a pressure device inside the vagina, at least for a couple of patients, so that you can actually measure, you can document that it's happening. Because many electrical stimulation devices do help, but not through the mechanism of contraction. It's a neuromodulation, really through the nervous system.
Yep, very fair comment. Thanks.
Thank you very much indeed.
Thanks.